Imagine you spend months analyzing some health data, and the result is telling you that a hip fracture is going to make older people healthier. That doesn't make sense. So you recheck your code, recheck your models, even ask your colleague to repeat the entire analysis, but the result is the same. This situation where you have the perfect method, but the result is entirely incorrect, is actually very common in data science projects. It is often due to one missing step during data preparation. My name is Warren. I'm a health data scientist. Today I'm going to walk you through this hidden data trap that is costing data scientists their jobs and companies millions of dollars. I will also share the data mindset I have to avoid these kind of mistakes. So let's get started. When we receive a dataset, nowadays it's very tempting to directly apply some AI models so that we can quickly convert your raw data into some key findings and insight. And if you are researchers, you might want to publish a paper quickly. And if you are an engineer, you might want to build some healthcare applications based on your dataset. But many people forgot that in real life, datasets are usually very messy, especially something like an electronic health record database. It often contains many data traps like missing values and conflicting or duplicated records that is going to mess up your downstream data analysis. Therefore, for data scientists, a good practice is to conduct an analysis called Exploratory data analysis, or EDA. The idea is that since data scientists are usually not the people collecting the data in the first place, so we need to take some time to get ourselves familiar with the data set, clean up the data, and also draw some early insight from the data. But when people talk about EDA, they often just think about data preparation and data summary. And I see many teams have ignored the steps of constructing a data dictionary. So you would actually be very surprised, like when you work with some big organizations, perhaps owning some huge electronic health record database or some high-stake data. When you start a project and you ask them, okay, do you have a data dictionary? And often, many times, they will tell you that, okay, we do not have something like that. So as a data scientist, you actually have to do some detective work to figure out the data structure and what the data is actually capturing. So before I talk more about what a data dictionary is about, I want to start with a simple example first so that you would know what's the consequence of not having a data dictionary. So seeing now here, we have a simple data set with 3 columns. When we get that, it looks clear. We have a patient ID, which is basically the identifier for the patient. We have a variable called hip fracture, and it's coded either by 1 or 0. If you're a data scientist following the data conventions, you would assume that if you see the value 1, that means the patient had hip fracture. And if you see the value 0, that means that patient did not have hip fracture. And again, with AI nowadays, it's very tempting to directly plug in this raw data set into some AI tools. And then, say, using Gemini, it could actually do a decode for us, breaking down what each column actually means. For example, here, this is basically what I have mentioned. It's stated patient ID as an identifier for each individual patient. Hip fracture is a binary indicator showing the presence or absence of hip fracture, and it even gives an example of interpreting the first patient status. So with that, you might be confident and think that, okay, I can now describe the status of each of our patients here. But surprise, in this case here, the first patient actually did not have hip fracture. So this is actually very common when working with real-life projects. Because remember, the people who construct the database, they did not do that to make your job as a data scientist easier. And they may not have any knowledge about data convention as well. So it is entirely possible that the people constructing the database have coded 1 as the absence of hip fracture and 0 as the presence of hip fracture. So you can see how this could flip our entire analysis going forward, because we do not know that whenever we thought we are focusing on the hip fracture group, it's actually the non-hip fracture group. Another example is the date variable. If say you are from US, when you see this data format, you would assume that, for example, for the first one here, it would be the 5th of January 2003. But say you are from the UK system, or like me, I'm from Hong Kong. To me, this is the 1st of May 2003. And for example, for my PhD project, I actually have to deal with database from multiple countries. So sometimes you might have the wrong assumptions that the other databases that you are working on would have the same format as your the database you are familiar with. So these are some details that we have to be careful as well. And therefore, having a data dictionary is super important. So basically, a data dictionary is a document that's going to describe the data structures and, more importantly, what each of the variables in your data set is actually capturing. So not only we need the definitions of the variables, but whenever there's some key involved, we have to clearly indicate what those different codes actually mean. For example, here we have a variable called survival, and here it indicates that, okay, when we see the value 1, that means yes. And when we see the value 0, that means no. So this is just a very simple data dictionary, but a proper data dictionary could even be more detailed. For example, here is a data dictionary from a health record dataset. It has a really detailed description of what each variables actually means. And you can see how it could get really complicated. For example, in a huge electronic health record database, you would not just have one single patient ID. Here you have like subject ID, but for example, you also have a ID which is unique to a patient's hospital stay. And if, unfortunately, the project working on does not have a document like that, it's really a good practice for you to construct this documentation as the very first step of the project. When we have a detailed, well-written data dictionary, it will make your downstream analysis a lot easier. For example, once I know that the hip fracture wasn't coded as I expected, I could actually use a simple if-else statement to flip the coding so that it really follow the standard data science conventions, making our life doing the modeling part a bit easier. And also, once I know the format of the date variable, I can also clarify the format. And also, one thing to be careful, this is something I'm going to cover in future videos, is dealing with date variables is actually very tricky. Here, you wouldn't just see because this date column is right next to hip fracture. You assume it must be the diagnosis date of hip fracture. In dealing with health record databases, there are like really different types of dates. It could mean the date whether the patient were admitted to the hospital, or the date of hospital discharge, or the date where the record were entered into the system. It does not necessarily mean the diagnosis date. But if you got confused between the different date variables, it should again entirely mess up your data analysis. So therefore, many people say that in a data science project, the modeling part only takes up about 20% of the work. About 80% of your time would be spent on cleaning up and preparing your data set. It's only when you have a clean up data that is accurate, you could start drawing some initial summary from the data set. For example, here you can see that if we look at the people with hip fracture and without hip fracture, it's quite clear that there's a difference in the proportion of people who died within each of these two groups. In the hip fracture group, about 20% of the patient died within 1 year after hip fracture. But in the non-hip fracture group, only 5% of the people died within 1 year. So there could be some initial hints showing that there could be a potential relationship between having a hip fracture and mortality. So here you can actually see why data cleaning is so important. Let's say I misunderstood the coding of hip fracture and the non-hip fracture status, my entire conclusion could become opposite. I might think that the proportion of people who died would be lower in the hip fracture group, which could ruin my entire downstream analysis. So the concept of garbage in and garbage out doesn't just apply to software engineering, it applies to data science as well. If you have rubbish data as input, all your output and your result will be useless. Today we have talked about how a data dictionary is going to make a huge difference in our health, AI, or data science projects. Moving forward, we are going to cover more data traps and also specific methods we can use to analyze healthcare data. If you like my content, feel free to subscribe my newsletter. The link is in the description. I will see you next time.